Hi, welcome to Tactical Teams Prevention Programming, where we always work with two main goals in mind. First, we want to eliminate the potential of your own body becoming your biggest obstacle. And second, we want to ensure you can function outside of work and really enjoy your life, no matter how difficult things can get at the office. When we see a new patient, they fit into one of three different categories. They're either healthy and at risk based on their job, they're showing the first signs of an injury, or they've been diagnosed with an injury and they're seeking our care. Based on their category, we devise a treatment plan just for them. So we traveled around and asked a few of our clinicians to give you a little bit more information about exactly what steps every person will go through, or what steps the clinicians go through with every new team. Take a look.
Here in our program, we really focus on the structural firefighters and how we understand that every body is really different. We use a lot of different functional screening tools to understand how every body is different and they complete different kind of movement patterns in different ways. We need to find a way to understand how your body reacts to different stresses. The way that we do that in different situations is using the functional movement screening tool. That is us testing the core function of a structural firefighter. One thing with this is that we really make sure that they are having their gear on when they're completing this test, and we see how that they are able to maneuver through different structures as they would in their workplace. For them, it would be a burning building, trying to maneuver through all those different things and how their core reacts to that. Typically, if they have a weak core, that usually resorts in low back pain or low back soreness. Over time, this can result in degenerative disc disease and other kind of spinal pain. So kind of the combo of weak musculature around the spine and general spinal pain, we have that in combination with heavy equipment like the helmet, and then that just leads to a really difficult combination of pretty disastrous elements for a firefighter's health.
Our first line of defense in combating injuries includes a heavy emphasis specifically on education. Each patient learns proper movement through their activity. So specifically with like SEALs and firefighters, either that being functional firefighters or even wildland firefighters and police officers, they all go through a different type of movement in their job setting. And so being able to find those individual movements and finding how those movements are affected through their job and how they can result in certain type of injuries can actually help us be able to mitigate those problems. So specifically with the SEAL program, we like being able to instruct and educate on their movement patterns through their day. And as something we see a lot of type of rotator cuff or shoulder issues. And we like to educate on proper muscle contraction through those movements and trying to find recruiting musculature to help eliminate some of those future problems occurring.
Once a patient begins to show signs of potential injury, we immediately intervene to decrease the effect it has on the body. The frequency of shoulder strains in the police force, we've developed a system of worksheets like the DASH, the disability of the arm, shoulder, and hand. The questionnaire was designed to help describe the disability experienced by people with upper limb disorders and also to monitor changes in symptoms and function over time. We paired that with mobilization and movement to reduce pain, increase function, to keep police officers on the job as much as possible.
In the wildland firefighter population, we often see patients that have something called carpal tunnel syndrome. We are always working on improving function, restoring range of motion, eliminating pain, and making sure that at home or at work, everyone can function to their full capacity. For example, with carpal tunnel syndrome, like I mentioned before, there's a nerve that runs down the arm and into the hand that can be really inflamed, and also muscle can pinch down on it. This is caused by all of the gripping of the really heavy tools and maneuvers that wildland firefighters have to do to get their job done. So with nerve gliding, what happens is we reclaim that territory that the nerve should have to move in the first place. So this is going to decrease the sensations of numbness and tingling and pins and needles. And to maximize the effect of this exercise, we're also, like I said, going to send those patients home with a couple of exercises to complete 2 to 3 times a week to make sure that everything's going smoothly.